For this exercise, we're going to start off lying on our back with our butt about 4 to 6 inches away from the wall. So that's pretty close. All right, and we want to be close enough to the wall so when we're in this position, our knees are no longer straight up over our hips. Our knees are actually closer towards our chest. And from here, let's make sure that the shins are also parallel to the ground. So lower your feet a little bit. And as always, let's make sure the feet are straight. So why don't you slightly point your toes in so the outer edge of your foot is straight. From here, we're going to take a yoga block or a foam roller, and we're going to place this right in between your knees. And your job over the next 4 minutes is going to be to hold this in place. Now, you're squeezing inward probably about 25%. This isn't a let me really try to squeeze this object as hard as possible. We are trying to stimulate the groin, the inner thigh, and the hip flexors to help stabilize your pelvis in a deep squat position. Now, she is laying down, but if you were to stand up in this position, this would be an almost ideal squat where the hips, shoulders, and head are all sharing a straight line while the hips are in a deep flexed position. So this is a great way to start practicing and introducing the mechanics of what your legs need to be doing during a squat. Why I also love this exercise too is it's teaching your hips how to primarily stabilize function while relaxing your entire upper body. We're laying down on the ground how we would want to be standing, which is, again, the hips, pelvis, shoulders, and head are all along a straight line. So take a couple deep breaths. If it's not too much effort, close your eyes. And your body is in, ideally, a really great balanced position. Your left leg is in the same angle and position as your right leg. But you might not feel balanced here. You might feel one hip flexor working tremendously harder or different than the other. Both hips might be shaking, but one could be shaking more. If we're putting your body in a balanced position and you're experiencing imbalance, this is just the nature of your imbalance showing up. Trust the position and trust that if given enough time, patience, and practice, your physiology will start to be able to do balanced positions like this and feel balanced while you're doing it. Friendly reminder to take another couple deep breaths. Lower back is relaxed, your abs are relaxed. This is about working on the deep function of your hip flexors. So it's totally okay if they have not been able to work for some time. You've probably relied on your abs or your lower back or your shoulders or neck to try to help this muscle group work. So aside from the work happening in your hips, the other intention of this exercise is to relax your entire upper body while your hip flexors restore and regain access to their function. If the imbalance is strong enough, you might actually start to notice that that block veers towards the right if the right hip flexor isn't strong enough, or it might veer towards the left if the left hip flexor isn't strong enough. And I don't want to make it just about the hip flexors too, because this is really 58 muscles in your lumbopelvic hip complex that you're asking to stabilize in this position. So if you notice the block trying to move right or left, just try to gently guide it and keep it straight in the middle, right above your pelvis. Now, that's about 4 minutes. You, of course, have the option to hit pause, and you can stay here longer if this just feels good for you. I'd say a max that you should stay here is about 10 minutes, but explore if you want to hold this a little bit longer or if you just want to move on to the next exercise. Great job.